this is going to be an interesting one. In 10 minutes to your health this morning, we take a look at a new form of skin therapy that aids in naturally smoothing and tightening the skin. It's called platelets-rich plasma, PRP. And here to tell us more is dermatologist and founder of Dermatology Solution, Dr. Arusha Campbell-Chambers. Who's going to tell you, don't try this at home.
Definitely morning.
How are you?
I'm great, thanks. Thanks for having me.
Where did this come from, though, Dr. Campbell?
Okay, so
yes.
Platelet-rich plasma, I know it sounds a bit scientific and complicated. Plasma is basically the liquid part of your blood, okay? And so we have found that using your own body to heal itself, we can achieve a lot of things. And it has been around for a while now. From the 90s, it's been used in different areas of medicine. In sports medicine, it's been used as well. And it's discovered that it can also help to rejuvenate skin, help with hair loss, stretch marks, wrinkles, and so forth. So basically what happens is that we take blood, just like if you're doing a blood test, and we process it. So in the way we prepare it at Dermatology Solutions, we get rid of the red yucky stuff. So people have seen in the press where abroad sometimes they use some kits that end up looking like actual blood. When we do it, it's the clear yellowish plasma, right? And this has a lot of platelets. What are platelets? These are cells that are responsible for helping your blood to clot naturally, and it also releases a lot of growth factors. So it tells your skin, come on, grow, rejuvenate, hair, hair, grow. It has been used in a lot of areas for joint problems, for erectile dysfunction, lots of different areas it can be used for.
That part, the erectile dysfunction. Like that
you
part.
like being dysfunctional?
No, I just like to hear about when you say it's used in sports medicine, what do you mean? In what way?
So for certain injuries, sometimes ligament injuries, tendinopathies, different things, it can be used because what it basically does, it shortens the healing time of your body. And we have seen scientific studies where it has safely been used when you have patients who they've used one side of the body with just, let's say, salt water and the other side with PRP. The PRP side does a lot better. It grows, like the skin gets thicker. It's more rejuvenated, and we see, actual patients that we've done, they've been very pleased because it seems to take back about even an average of 10 years off the skin.
So it has to be my blood?
Yes, most definitely. Yes. So we're not going to give you somebody else's blood.
So I'm going to come with Neville and say, I want my good skin.
No, unfortunately.
But in a serious way, physically what happens? So you take the blood, I want my face to be a little bit tighter. What you do now?
Okay. All right. So at Dermatology Solutions, we have what we call the Fountain of Youth treatment, where we combine PRP with other procedures. So when we actually get to doing the PRP, after the blood is taken and it's processed in a machine, we take up the clear yellow liquid in a syringe, and we basically inject it back into your skin. And we have different methods of doing it. We also incorporate dermal needling. We numb the skin, of course, so the patient is comfortable. They're comfortable.
Where exactly
and you put it, you target the wrinkled areas, but it's put generally as well.
Okay.
And then basically what you expect, right after the face is going to look a bit red and may look a bit puffy, that goes down within hours or days. And then usually about a few weeks after, because what we're trying to do is stimulate your skin's collagen. This is like the mattress of the skin, that middle layer that gives the skin the support. So it takes about 4 to 6 weeks after one treatment for your collagen to build up. And the beauty of it is...
What's that we're looking at? What's that we're looking at?
So... Okay, so this is a picture of Kim Kardashian, and they did their treatment, and she looks a bit bloody there. You don't leave the clinic looking like this. We, of course, get rid of that look.
And what would cause that look?
The process of needling the skin, because, when we stick you, you'd have little pinpoint bleeding, but you're not going to leave looking like this at all.
I wouldn't leave looking like I come with that parcel.
No. So basically what you find is that months after, it gets better, and the same person just looks naturally younger.
When you say needling, we're talking about acupuncture type needling, or we're talking about like Cayman and Spark horse needling?
No, right, so not that. We're talking about very tiny needles, much smaller than what you'd use to take blood with, right? And so what we do, we numb the skin first, so you're in office with the skin numbed, and then we use a machine, a device, an electronic device, to basically established, very tiny pricks, and I'm talking about 2-3 millimeters. So that's little tubes, as we would say, into the
So
skin.
you do it for me, and my face is tighter, looks better.
Yes.
And it lasts for how long? After do
Right. That's the beauty of it. It doesn't really wear off. The rest depends on your aging. So I was here in a previous interview with you guys talking about aging skin.
Right.
If we remember, we age 2 different ways. Your natural internal aging process based on your genetics, your hormones and stuff, and then external or premature aging based on your lifestyle. So if you're going to be in the sun all day smoking, stressed out, you're going to age at a faster rate thereafter. But really, once we've done it, and we normally recommend 1 treatment every month for 3 months at least, and then you can decide if a few years down the line you want to do it again. But it's not something that wears off. We've set back your clock.
In his 20s, and you see him look like 79?
How prohibitive is the cost, or is it?
Right. So the cost ranges depending on the kit that the person is using. So if somebody gets something from China, you know, it depends on where they source their material. So you can have knockoff stuff, you can have shortcuts, and then you can have, so it really varies a lot. So I wouldn't get into specifics per se, but it's certainly not in the region of, like, you know, facelift and so on, and it's, you know.
Are we becoming more and more astute when it comes to dermatology in Jamaica? I'm seeing more and more people saying, I'm going to go to the dermatologist and check out my skin.
Right, I believe so. I think with social media, the internet, people are getting more aware that things can be done. My personal view on it is that of course, we do much more than treat wrinkles. We treat diseases of the skin, hair, and nails. And so it's important for patients to know they don't have to live with stuff. You don't have to be living with acne as a rite of passage as a teenager for years. It can be treated. So patients are getting more aware that there's treatment out there. And to me, I always make sure something is safe. You know, we ethically have to do no harm. So once it's safe and, you know, once it's suitable for you, then go ahead and do it. But don't do anything
crazy.
Going
back to PR,
sure.
Are we doing it?
Yeah, we're doing it. It's definitely growing in demand, as I said, with different reasons. Hair loss, it really has, you know.
Hair loss?
Hair loss, yeah, because it helps to stimulate hair growth. So it can be used as well in persons who have female pattern balding, male pattern balding, and so on.
And then where would that, to get back, because I have a little spot
we inject that area.
In your head,
so the same process, but wherever it is needed. As I said, it has been used for decades all over the body.
Looking at that now.
Yes, precisely. So that picture shows a before and after of what is possible.
I feel.
And it can be combined with other treatments too.
So, like women who lose their edges and those things, they come and get that done too.
Right. So there are many different types of hair loss. So when we analyze it, we would recommend if PRP is suitable. If there's a lot of scarring, then we may not get as much results as with non-scarring causes like, you know, female pattern hair loss and so on.
Right.
But yes, certainly we either use it alone or in combination with other things.
Ms. Arusha, did you say it makes things grow?
Yes. Yes. So it basically...
She also said it depends.
On what?
If growth is possible.
So basically, it basically stimulates your body to produce more tissue. So it increases your blood. It increases your blood vessels formation. It increases collagen. It increases, you know, bone cell formation. Wherever it is put, it increases the area and it increases the blood supply to the area as well.
Work with me now. So any part of your body, it would make it
can
grow.
be. Yeah, it has been used. I'm sure you've heard of different shots and so on. That is what is behind it.
That may love you. No. Where is your place, please?
So we are located. We're now also in Kingston and Montego Bay, and St. Vincent too. So in Kingston, we're at Unit 2 and 21, Barbican Business Center, 88 Barbican Road.
You're never going to disappoint. And we're
and also we're in Sagicor Montego Bay Commercial Center, upstairs Howard Cook Boulevard.
Yes. What are you open?
We open at 10 a.m. usually on weekdays.
I don't know one favor or the ask. When he makes the appointment, I would have liked to do the injection.
You guys are well suited to each other. You have a lot of fun here on mornings.
Great to see you.
Great to be back. Thanks for having me again.
All the very best for 2018.
Yes,
dermatologist and founder of Dermatology Solutions.
And dream maker. Dr. Arusha Campbell-Chambers. Yeah.
I feel like when just come up with you now, Doc.
Have a blessed morning, folks.
10 minutes to your health. We'll do it again next Thursday.
You're going to disappoint you. I warn you.